We've used certain tactics we're all very aware of closing restaurants, closing schools and universities, stay-at-home orders, mandatory mask wearing, etc., to try to reduce the number of COVID deaths. And presumably that has reduced the number of COVID deaths. So I want to know, though, how many COVID deaths have been prevented. It's surprising to me nobody's done this. As far as I'm aware, nobody's done this yet. But can we make an estimate of how many COVID deaths we're preventing? So back to the question of how many infections our policies are preventing and how many deaths, therefore, they may have prevented. To answer that question, we need to know first what percentage of the population has already been infected and what percentage and how that corresponds to number of deaths. The best way to do that is to do an antibody test. When you're infected with COVID, your body generates antibodies against it. Those stay for a long time, possibly years. So later we can collect blood from that person and determine whether they've got antibodies against COVID or not, which tells us whether they were ever infected or not up to that date. So there was a very clever study that was done in early July where they studied dialysis patients. So every day, thousands of people in the United States undergo dialysis. And their plasma samples, their blood samples, are sent to central laboratories where a bunch of routine medical tests are done on their blood, just as part of their routine medical care. So these researchers got a roster of over 20,000 Americans who were dialysis patients that were sent, their samples were sent to one particular central laboratory, but people from across the whole country. And then in early July, they got the roster on June 15th. Then in early July, they collected blood samples, or their dialysis samples were sent to the central laboratory, as they all routinely were. And they had samples from 20,000 people from across the country and could test these for antibodies against COVID-19 to see if they'd been infected. And so they did that for over 20,000 people and calculated what percentage of the population had been infected by early July with COVID. And they determined that it was 9.3% of the population. They did that not just by the percentage of their samples. After getting the percentage of their samples, they then adjusted for the age, demographics, and zip codes of the patients whose samples they had, and adjusted that to the age, demographics, and zip codes of the entire United States population, and came up with this number of 9.3%. Now, it takes 7 to 10 days to get antibodies, so that means people were infected, and these were collected in early July, so that means people had been infected by about July 1, when you could say that 9.3% were infected by about July 1. Also takes on average about 2 weeks after infection for a person who is going to pass away from COVID to pass away. And so the deaths I'm using to compare to this 9.3% that were, the date for the deaths that I'm using to compare to the 9.3% who were infected by about July 1, I decided to use the date of July 15th as probably the best comparison date to calculate what percentage of infected people die. And so if 9.3% of the U.S. population was infected, we can multiply that by 328 million, which is the U.S. population, and come up with a certain number. So that's your denominator. Your numerator is 140,775 people had died as of July 15th from COVID. And so that works out to a case fatality rate, the percentage of people who are infected overall who die, of 0.46%. Now, by November 25th, the number of COVID dead had increased to the number shown on this slide, and that's a 1.9-fold increase. So if you multiply the 9.3% by 1.9, you get 17.7%. Now, I've shown here that the number infected as of November 25th then would be equal to or greater than 17.7%. And the reason I say it may be greater than 17.7 is that everybody believes the case fatality rate is going down over time. We know there's been a mutation in the virus that has pretty much taken over the population of the virus, and that mutation makes the virus less deadly but more contagious, easier to pass from one person to another, which, if you think about it, is the evolutionary interest of the virus. The virus doesn't have any particular interest in killing us. It just wants to spread to another person. So its interest is becoming more contagious. It doesn't have any particular interest in being deadly. Also in New York City, there was a report that the percentage of hospitalized COVID patients in the spring wave in April or so who were dying was 23 or 27%. I don't remember exactly the number. And then in the fall wave now, it's only 3%. So clearly the percentage of people who are infected who die is going down. So if that's going down, it's at least 17.7%, maybe somewhat higher. Okay, so with that data of the percentage of the U.S. population that's been infected, that gives us a better chance to estimate how many lives our policies, how many infections, and therefore how many lives our policies are saving, are preventing. How many deaths we're preventing, I should say. So as of November 25th, then about 20% of the population was infected. As of that date, as of July 15th, 34% of New York State was already infected. And New York State's deaths have plateaued since then. They have not increased very much. The U.S. deaths are 1.9-fold higher, 90% higher than they were on July 15th, as of November 25th. New York State's deaths had only increased by 6%, factor of 1.06. So if you multiply that, New York State's infection rate is about 2% higher. If you multiply it by 1.06, they've about 2% more of, times 34%, about 2% more of New York State is infected. So they've only gone up 2% from 34% to 36% in this time, assuming the case fatality rate has stayed the same. So they're plateauing near 40% infected of the population. They're getting herd immunity, basically, or quasi-herd immunity, near herd immunity at that level. So I think a generous estimate would be that we have prevented 15% of the population from being infected. So that would mean we've prevented ourselves from going from 20% to about 35% by now. Or another way of looking at this is that the University of Washington COVID model projections, they're projecting now in a best case scenario, if we do even better than we're doing now on the mask wearing, et cetera, that by March 1st, there will be 406,000 U.S. COVID dead. If we add 200,000 to that, that would be 606,000. That corresponds to a percentage of the United States population as a whole infected of a little over 40%. New York State isn't even at 40% yet, and it would correspond to a death rate that's quite a bit higher than any nation in the world has achieved. I think it's kind of a worst case scenario that our policies have prevented 200, or a best case scenario, that our policies have prevented 200,000 deaths and 15% of the population from being infected. Now, obviously, that's a huge number of deaths. 200,000 deaths we're preventing. So that would be tremendous if that's the case, that we are preventing 200,000 U.S. deaths from COVID. And we calculated that the average life expectancy of the people who are dying from COVID is 4 years. So we would be adding 800,000 person years of life by preventing those 200,000 deaths, if that's what we've been able to achieve. However, if you divide 800,000, or 0.8 million person years of life, into the U.S. population, which is 328 million, you get 0.0024 years of life expectancy gained, which works out to 0.9 days. So I ask you, have these restrictions that we've been undergoing for 9 months, has the way you've been forced to live for the last 9 months, has that been worth it to you to add 1 day, less than 1 day, to your life expectancy? I know how I would answer that. No, no, no. I wouldn't have even been willing to give up handshakes and hugs for a year to add 1 day to my life. Now, some may object, you're not trying to add 1 day to your own life, you're trying to add 1 day to somebody else's life. You're doing this for the elderly, for somebody else. I don't think that changes the calculation. The Bible says, love your neighbor as yourself. It doesn't say love your neighbor instead of yourself. You're as worthy of love and consideration as anybody else. So the way to think about this ethically, I think, is would you be willing to make these sacrifices in order to add 1 day to your own life? Now, another objection people may have is, well, you're not trying to add 1 day to somebody's life. You're hoping to add 1 year or 4 years or maybe occasionally 20 years to somebody's life. Okay, fair enough. If you want to look at it that way, then the question is, would you want to have done what we've done, made the sacrifices you've made for 9 months in order to gain a 1 in 400 chance of adding a year to your life, or a 1 in 1,600 chance of adding 4 years to your life? I don't think it changes the calculation. It actually just kind of confuses the issue to think in terms of probabilities like that rather than to think of it in terms of a certainty. So I think the easiest and best way to think about it is, would you be willing to have made these sacrifices to add 1 day to your life?